Morning, everyone. This is Jay Mann with Amada Senior Care. I'm joined today by Craig Rasmusson of Active Medicare Solutions. Welcome, Craig.
Yes, thank you.
Very glad to have you here. Great to meet you. I'm meeting Craig for the first time. He's doing great work in the senior community. I've worked in healthcare for 30 plus years, as we were just talking, and I will say that my understanding of Medicare is very small. Yep. So if you wouldn't mind helping the audience and me by understanding what Active Medicare Solutions is in business to do and how to help people.
Absolutely, yeah. So Active Medicare Solutions, we're a full-service Medicare insurance company. Well, we do all health insurance.
Okay.
We put a strong focus on Medicare. We have locations here in 𝗏𝗏𝗏𝗏, and really what we do is we meet with people that are getting ready to go on Medicare.
Okay.
We meet with people that are currently on Medicare. We educate them on their options. Educate them on whether or not they even need Medicare, okay. Get them signed up, and then provide them service moving forward.
So you are an all-encompassing resource for Medicare Solutions?
We are, absolutely,
okay.
Yeah. Everyone that's on Medicare comes to us to either review their situation, get a new plan, all sorts of stuff.
What person needs to enroll in Medicare and who doesn't?
Yeah, that's probably one of the biggest myths out there. There's a lot of people that think that because they're turning 65, they're talking to their family, they're talking to their friends, they say you need to enroll.
Okay.
And I find that about 30% of the people that come into my office do not even need to enroll in Medicare at all.
Interesting. Okay.
Yeah.
And what are some of the myths that people are coming to you for and saying, I need this because? What are you seeing as some of the misinformation out there?
Yeah, so I think, again, the fact I think is you need to get started early when you getting ready to turn 65 to first find out whether or not you need it. There's a lot of people that they're still working, they're covered by their group plan, they have more than 20 employees.
See, I thought it was always just it's an automatic, that once you're 65 you should get it and that's just what happens. Is that not the case?
That is definitely not the case, and there are oftentimes, if you do get Medicare, it will actually hurt you. For instance, if you're working, and you're covered by a group plan, you like your plan, a lot of times you have a younger spouse on the plan.
Right.
You still would like to evaluate your options, but more than likely you're going to stay on that group plan and you don't have to take Part A or Part B. And oftentimes if you're contributing to an HSA, it'll hurt you if you take Part A or Part B.
Interesting. But now, so help me understand, if you will, Medicare and insurances can work hand in hand, or is it one or the other?
Yeah, typically if someone is working and they have a work insurance, they would choose not to take Part B.
Okay.
Just because of the cost factor and because of some of the other options. There are some reasons they would, but usually if you're working, you wouldn't take Part B. So you're not going to need to worry about how that coordinates.
Okay.
And there are times that people have too many insurance plans, to be honest with you. So
okay.
That really comes back to when we work with clients, the first step is really deciding whether or not they need Medicare.
Right.
And putting down a game plan. And once they need Medicare, then we teach them how do you get it, because it's not automatic. You aren't always just enrolled.
All right, interesting. I mean, we could talk about this topic all day, and I know that when I'm meeting with our clients, one of the first questions they ask me is, home care, it's covered by Medicare, right? And I say, well, unfortunately at this time, it's not. And that hopefully that changes at some point, because I know that certain Medicare Advantage programs have had allowances for certain aspects of home care for some time. But I'm going to ask you one more question, because I know we're going to wrap up at some point soon. But Medicare Advantage.
Yeah.
Who would need a Medicare Advantage program, and what advantages is that bringing in addition to the Part A and the Part B?
Right, so that is the big question. So when you go on Medicare, you first have to decide whether or not you need it. You then have to decide how to get it, and then you need to decide whether or not you're a Medicare supplement or a Medicare Advantage person. There is so much more that goes into that conversation that we can answer right now.
Okay.
It's more of a gut feeling. When you have Medicare, original Medicare, people choose that because of the flexibility and the predictability.
Okay.
And there are groups of people that would rather have a Medicare Advantage plan, which is where Medicare outsources your care to a private carrier. It works similar to work insurance. You have one card. There are advantages to Advantage plans. You often get dental, vision. It may cover some things that Medicare doesn't cover, but you definitely want to know what those choices are and which one makes the most sense to you.
That's wonderful information. We could have this conversation all day. There's so much information here, and in the field and working with seniors, we help people with understanding different ways to pay for various aspects of care. In Craig, we have a resource now for Medicare that clearly you'd be able to work with so many different families and help them. Craig, I can't thank you enough for coming in today. It's great to meet you. I'll look forward to working together.
All right. Thank you, Jay.
J-Man with Amada Senior Care signing off on another episode of Job with Jay. Have a great day.